Hamzat Uthman, medical outreach. I make sure pé wọ́n wà orderly, à ń tò wọ́n, wọ́n bá ti tò wọ́n tán, a ṣẹ̀ṣẹ̀ wá bẹ̀rẹ̀ test tí a fẹ́ ṣe fún wọn. Basically, à ṣe fasting blood sugar fún wọn. A máa attend sí ìgbà mi 100 to 150. Yes, maybe.
Folashade Shittu. I'm a nurse by profession, so we take the patient vitals to know where they have problems and their health challenges. After the station, we refer them to the doctor. So after visiting the doctor station, the doctor refer them to the pharmacist to collect their drugs. 8 years now. Between 7 or 8 years.
Orúkọ mi ni Dr. Abdulrasheed Adekeye Odunola. I'm also I work with University of Ilorin as a chief medical officer. I'm currently the director of University of Ilorin services. And lágbára Ọlọ́run mi fún mi ààrẹ gbogbo àwọn tó jẹ́ doctor tó jẹ́ ọmọ ìlú Offa home and abroad. So the president of our doctors home and abroad. Thank you. Well, this Islamic Medical Foundation being sponsored by Chief Ibraheem. And this thing has been on for more than 10 years, in which we have medical personnel, doctors, nurses, pharmacists, laboratory technicians and technologists, and other health workers that come here on a monthly basis, precisely the last Sunday of the month, to give free medical care to Offa people and even the surrounding towns. As far as Osun States, as far as the record one in local government, because you see people coming from Nigeria, so this thing has been on. They come from Nigeria. On a monthly basis, we see not less than between 600 to 800 people being treated. Now, when you look around, not less than 80% of the people you are seeing here are old people. Not less than 90% of people you are seeing here are female. So basically, most of the common medical challenges we see here are hypertension, diabetes, arthritis, then people that have ulcer. So then we treat people for nearly everything, but those are 4 conditions that I've mentioned. They are nearly on the leading medical treatment that we do here. Hypertension, diabetes, we treat arthritis, ulcer, and many a times we treat malaria fever. So those are the things. And apart from treatment, the founder also assists people for surgical procedures. They bill people. If you have a surgical case, you tell him, you get a place. There's a place that arrangement has been concluded where that surgical intervention is insured and you pay for it. And occasionally, when we have people that need medical or financial assistance, we still used to give it.
I'm Dr. Olabashid. Okay. Most of the time you see more. It's actually a monthly program, just like I'm sure most of our people must have explained. So whenever we have this program, you see we have cases, most especially more cases of hypertension, diabetes, case of common infections like malaria, sometimes upper respiratory tract infections, and most especially issue of musculoskeletal issues. So those are the major cases that we do see here. Sometimes too, we see surgical cases that might need for us to make special arrangement for them to do surgery outside the venue here. And sometimes there will be some cases that we need to refer outside. Maybe if we have emergencies or like hypertensive urgencies that like, there might be need for us to refer them outside so that they have a better follow-up. We still keep up with them. So outside what we provide there, we still give outside process.
My name is Mrs. Adepoju Tolulope Taiwo. I'm Health Information Officer. We register the patients. After the registration, they go to their various aspects here, which is the BP. They do vital signs. After the vital signs, they see the consultants. After the consultants, they go to the pharmacy. So after the pharmacy, which is the last place, we do the filings. We used to file all those records that have been used back to their respective file. The first time we register all these patients, we register them inside our register and we give them small cards, which is known as identification and reference card, that help us to identify each patient with their respective number. This place is free of charge to everybody. Yes, yeah, every last Sunday of the month.
Pharmacist Olagunju Abdulwasiu Oyewale. That's my name. Yes, we are here at Bremen Garden, and what we do basically is to attend to patients across ages, both children and adults. We fill their prescriptions, and we also look at the rationale for most of the prescriptions prescribed. Our drugs covers common diseases in our environment, such as hypertensive agent, antidiabetic, and we take care of geriatrics. You can see most of our patients here are adults and they are elderly people, and of course we have drugs that are actually taking care of them. We also have antibiotics for some of these ailments. Like I told you, the drugs we have here is still along the diseases that are common to geriatrics and people that we are actually taking care of here. So that's what we do. By the grace of God, the sponsor has been consistent for the past 7 years. We have been doing this every month without for once failed. So we have been attending to people's needs in terms of medication and health-wise for the past 7 years here. Yes, like I told you, we provide pharmaceutical care for most of our patients that come here. For the elderly, we give them proper advice and counseling. And for people who are hypertensive, we give them counseling on the importance of consistency with their medication. For diabetics, of course, we give them appropriate counseling for consistency with their drugs and other non-drugs approach to their treatment. And cases where we feel that we need to refer, we also make a referral and provide appropriate education that will help them in the management of their various diseases. And that's the advice we basically give. Generally, we also give well-being advice to our patients, lifestyle modifications and other forms of counseling that will make the treatment appropriate. And cases of we also enshrine in their belief that this is an outreach, is not an hospital, and they should also patronize their hospitals and also coordinate the treatment with their doctors, various doctors, when they leave this place. But what we provide basically is to assist in their medication and also to assist in the management of their diseases. But we are not in any way an established hospital. We also refer them to their caregivers in order for them to continue their care.
Mo wá tọ́ àlàáfíà ni mo bá wá síbí.
mo wá gba ìwòsàn lọ́dọ̀ Alhaji Bírímù tí ń ṣàánú ayé ọlọ́ba wa ṣàánú náà. Bá a ṣe gbọ́ nípa wọn ni wípé àwọn gangan làbá máa pè ní ìjọba mẹ̀kúnnù aláàánú. Láti ìgbà tí wọ́n ti gbé kínní ìkàlẹ̀ lẹ̀ wọn ò bá ọba tó láàánú bá fàánú rántí wọn. A rí wọn ní ìrí ẹni tí ń ṣàánú mẹ̀kúnnù ni. Àsan tọrọ àsan kọ́bọ̀ níjọ́ tá à ń ti wá àyàn àgbowó àsanwó káàdì rí. So wọ́n sì ń fún wa ní nǹkan tí ń ṣe wá láǹfààní à ń gbádùn. Ìta fi 10,000 naira wọ́n ń fún wa lọ́fẹ̀ẹ́ ní àná. Àwọn náà ò ní sàárẹ̀ ní ti tó bóyá kí n ní 2,000 èmi o, ṣùgbọ́n tí wọ́n ti bẹ̀rẹ̀ kínní a ti wà ní ọdún méje báyìí. Ọlọ́run ọba wa tọ́jú àná.
Láti ọdún méje tán ti bẹ̀rẹ̀ náà lèmi ti bẹ̀rẹ̀. Tí mo sì ń wá lójú gbogbo ọjọ́ tí wọ́n ṣètọ́jú wa o. Ó bá mi lára mu mi gan kódà ìkíní tí a ṣe lẹ́nu ọjọ́ mẹ́ta yìí ní ojú níbẹ̀.
Ọlọ́run ní jàre òsè òní fàìsàn sáyé rẹ pẹ̀lú ògbó
gbèsè rẹ̀ náà torí wọn ò ní jẹ gbèsè.
Bá a bá rírú wọn mẹ́rin lọ́fà yìí àárẹ̀ tán. Irú Bírímù ìbá pé mẹ́rin tó pé 5 lọ́fà yìí àárẹ̀ ti tán yányán.
Ẹni tí ọ̀rọ̀ rẹ̀ bá sì tọ́ ṣépè wàhálà yóò gbèpè o. Ṣé ẹ mọ̀ bẹ́ẹ̀? Ẹni tí ń ṣe ń tà ń ṣe yìí ṣẹ̀gbọ́n ọ̀rẹ́ tọ́ sàdúrà. Tábàárẹ̀ nìkan tó bá ní àmọ́ṣe má lè ṣe ṣẹ̀gbọ́n ọ̀rẹ́ tọ́ ṣépè nù. Àmọ́ ẹ jẹ́ ká farabalẹ̀ kán mọ̀ pé ẹni tí farabalẹ̀ ni wá ń bí. Ọlọ́run ní bínú sí wa. Orúkọ tèmi ni Habeeb Akewusola tí mo jẹ́ ìkànnù àbúrò ẹni tó ń organize prógrámù yìí ní prógrámù yìí. Èmi ni wọ́n yàn pé tí mo represent gbogbo ilé àti lè attend àwọn èèyàn wa láti máa mójútó àwọn ìyá níbí bí. Ìmójútó àwọn ìyá sì níbí ni pé wọ́n rí pé mo lè rojọ́ púpọ̀ á sì mọ̀ pé ìjà ò lè má sí ibi tí ọ̀pọ̀ èèyàn bá wà láti lè máa bá mi láti lè máa àdírẹ́sì àwọn ìyá náà. Pàápàá bí irú àwọn ìyá mi àwọn ìyá yìí wọ́n ti ṣe fúnpá nísìnyí tí ẹ bá kọ́kọ́ débì yóò kọ́kọ́ gba káàdì wọlé. Tó bá gba káàdì a ní káàdì kélébé tá a máa ń fún àwọn èèyàn tá a máa mú lọlé bí irú káàdì báyìí. Káàdì kélébé wà gbogbo èèyàn la máa ń fún tá a máa mú lọlé. Oṣooṣù tá a máa ń ṣe wọ́n máa mú káàdì wa òun la máa fi yọ káàdì lọ́dọ̀ àwọn ìyá káàdì ńbẹ̀ yẹn. Tán bá ti wá yọ tán à á pe orúkọ wọn wọ́n lọ máa jókòó síbí. Tán bá ti wá jókòó ó kù ká máa lọ síbi tí wọ́n ti ń ṣe ìfúnpá. Àwọn tó ń ṣe ìfúnpá wọ́n ò wọ̀n ìfúnpá wọn. Tá bá wọn ìfúnpá wọn tán èyí tí ìfúnpá rẹ bá high ológun kan tí a máa ń fún wọn tó fi sẹ́nu wọn ni ìyẹn jókòó náà. Ìjókòó wọn jẹ́jẹ́ tára wọn bá balẹ̀ wọn ni àwọn yẹ ìfúnpá fún wọn. Tá bá ti wá rí para wọn wọ̀n dáadáa tán fún ìfúnpá wọn ṣe dáadáa wọ́n wà ní yàrá kan máa tò. Gbogbo àwọn ìyá tẹ́rí tí wọ́n jókòó yìí dókítà náà fẹ́ rí wọ́n ti ṣe abẹ́rẹ́ ti ṣe fúnpá ni àwọn ìyá wa ti ṣe fúnpá dókítà ló kù tán fẹ́ rí. Tá bá ti wá ń tò bá ṣe ń tò ní number 1 àwọn dókítà náà jókòó yìí gbogbo àwọn dókítà náà jókòó lẹ́yìn tí wọ́n ń dá wọn lóhùn yẹn. Tá bá ti wá ṣe ló kàn wọ́n máa máìkì wọn lẹ́yọ kọ̀ọ̀kan. Tá bá ti wá rí dókítà tán wọ́n lọ bí òkè lọ́hùn láti lọ gba oògùn tá à ń fún yàn níbí oògùn oṣù kan ni. Oògùn táwọn èèyàn lò fódìdí oṣù kan là máa ń fún yàn níbí. Ọlọ́run má pa bọ̀dá náà láéláé. Ọlọ́run má pa Alhaji àwa Bírímù Ọlọ́run má pa láéláé. Ọlọ́run o wọ́n ti ń gbé bọ̀ ìpàdé wa mẹ́rin Ọlọ́run má jò tọ́ sí bàbá náà. Oògùn oṣù kan ni wọ́n máa ń fún yàn níbí. Àwọn dókítà gbé oògùn pálípálí dẹ̀ ni tá a lò fódìdí oṣù kan ó tún di oṣù tí ń bọ̀ kán tó tún wá gba oògùn míì. Ọ̀pọ̀ oògùn làwọn ìyá mi máa ń gbé wá pé àwọn òrógùn yìí lò tán wọn ò rí lò tán. Ọlọ́run dákun abẹ́ọ́ ikú tó yáwọ́ má fi pa Alhaji Bírímù o má fi pa Alhaji Bírímù má fi pa gbogbo wa náà Ọlọ́run wa bá a ṣàánú àwa náà Ọlọ́run gbàdúrà wa o kò jẹ́ bó ṣe jẹ́. Òkè lọ́hùn ni wọ́n ti lọ máa gba oògùn tẹ́ bá débẹ̀ ẹ bá àwọn oògùn bámú níbẹ̀. Èèyàn tó ti gbòògùn láàárọ̀ yìí àti 6:30 làwọn èèyàn ti ń débí. Àwọn èèyàn tó ti jáde tó ti gbòògùn láàárọ̀ yìí Ọlọ́run nìkan ló lè sọ. Èèyàn tá a máa ń dá lò níbi bíi níjọ́ ní oṣooṣù tá à ń dá lò
ó ju 1000 lọ ní oṣù kan, ó ju 1000 people lọ. Ní pé Ọlọ́run má pa bírímù fún wa o, Ọlọ́run má jẹ́ aláàjì bírímù tán, kò jẹ́ bó ṣe jẹ́. Bismillah Fatiha. Alhamdulillah Rahmanir Rahim Maliki Yawmiddin Iyyaka na'budu wa iyyaka nasta'in Ihdina siratal mustaqim siratal ladzina an'amta alaihim ghairil maghdubi alaihim waladdallin. Amina.